All right, good evening. Let's call this meeting to order. If you would join us with the flag salute, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, let the minutes show that all board members are present except for Mr. Nguyen. And do we have a motion for the adoption of the agenda?
So moved.
Second.
Ms. Romerman?
Yes.
Ms. McAdams?
Yes.
Dr. McNeil?
Yes.
Chair votes yes as well. Consent agenda. All of the following items, those items of a routine nature normally approved at board meetings, will be approved by one vote unless any board member desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items, A through SS.
Move for approval.
Second.
Dr. McNeil?
Yes.
Ms. Romerman?
Yes.
Ms. McAdams?
Yes.
Chair votes yes as well. We have a USPA report. UCTA report.
President Reyes, Dr. Federline, members of the board. First of all, we wanted to thank you guys on the board for coming to the kickoff. It means a lot to our staff that you were all there to support us. UCTA, we've been busy working on our membership rosters. Our reps have been getting in contact with all of our members, making sure we have all of their information. And then some of our reps even hosted welcome meet and greets at the sites at the beginning of the school year. That's all so far. We just hope to keep open communication with admin again this year. It's been great having that open relationship and being able to communicate with each other. So thank you.
Thank you. Hearings and correspondence? None? Okay, business agenda instruction. Consider and take action on the expenditure of up to $1,216,146.44 from the general funds to purchase textbooks, supplemental curriculum, and software for the 2025-2026 school year. Ms. Cal.
Yes. Good evening, Mr. Reyes, Dr. Federline, members of the board. This is my annual request from our textbook funds. We just recently received our allocation to approve the total of $1,216,146.44. This also includes a carryover from last year, and we will spend these funds on not only textbooks but also on supplemental items such as software. Ask for your approval.
Move for approval.
Second.
Ms. Romerman?
Yes.
Ms. McAdams?
Yes.
Dr. McNeil?
Yes.
And chair votes yes as well.
Thank you.
Consider and take action on an agreement with the Oklahoma State Department of Education, OSDE, and the Public Consulting Group, Inc., PCG, for Medicaid school-based health services, blanket purchase orders in the amount of $60,000, Oklahoma Health Care Authority, and $25,000 PCG, and authorize the board president, superintendent, or designee to execute the contract. Dr. Smith.
Yes, thank you. President Reyes, board members, and Dr. Federline. I'm recommending that you all accept and approve the agreement renewal and purchase order with the Oklahoma State Department of Education and Public Consulting Group for Medicaid school-based health services. This agreement allows the district to participate in the Medicaid fee for service program and for the Medicaid administrative claiming program. For added context, in the last 2 years, we have received around $270,000 in the MAC reimbursement, and since 2022, we have received over $830,000 in Medicaid reimbursement. So this has been a valuable revenue source for our team, and it's a fairly low risk, which with how the contract is developed. So we have some coverage from some different groups in terms of the billing aspects of it. So I'm happy to answer any questions you may have.
Do we see this taking a hit in the next year?
I hope not. But we really, Oklahoma didn't expand it, so we are not a free care state, so we can only bill for services listed on a student's IEP, and they've been very limited in wanting to expand that conversation.
Thank you. Move for approval.
Second?
Ms. Romerman?
Yes.
Dr. McNeil?
Yes.
Ms. McAdams?
Yes.
Chair votes yes as well.
Thank you.
Thank you. Consider and take action to approve the capacity levels and calculated open transfer capacity amounts as recommended. Dr. Nelson.
Yes, President Reyes, Dr. Federline, the board, I recommend that the board consider and vote to approve the capacity levels as stated in the attachment, and so that we can post these for October 1. The actual numbers were given on that same chart. We are already placing some students in those openings that we're aware of based on capacity that has been approved in the past, but with these numbers then we'll post something on the website according to availability. I know you have general interest in transfers. We have almost 1,000 now. We're at about 987 transfers. Just over 300 are children of union employees, and the transfer distribution is fairly equal from elementary to secondary and across various grade levels, with third grade being the highest elementary grade with 100 transfers. At the secondary level, 10th and 12th grades have 88 in those students. Have any questions?
Questions, comments?
Second?
Ms. McAdams?
Yes.
Dr. McNeil?
Yes.
Ms. Romerman?
Yes.
Chair votes yes as well.
Thank you.
Personnel, consider and take action on an agreement for insurance management services with Rooney Insurance Agency for employee benefit consulting services beginning January 1st, 2026, and authorize the Executive Director of Human Resources to execute the agreement and authorize payments pursuant to the agreement. Mr. Logren.
Thank you, President Reyes, Dr. Federline, members of the board. This is our annual renewal with Rooney Insurance. There are benefit consultants. They have been with us for many, many years. They have not increased their rates, has been consistent with them while providing great service. Anytime also, if they have any commissions that come in from any of our service providers, they credit those back to our bill and they save us money on our bill, and they've never kept those for themselves throughout our contract. So they've been great partners, and we look to renew that again this year with your approval.
Move for approval?
Second.
Dr. McNeil?
Yes.
Ms. Romerman?
Yes.
Ms. McAdams?
Yes.
Chair votes yes as well. Thank you. Consider and take action on the administrative services agreement with United Healthcare UMR to become the health plan third party and administrator, and approval of the monthly premium rates for employee, retiree, board members, and COBRA participants for the district's self-insured PPO medical indemnity plans, and to approve the plan changes, other coverages, and administrative services, including all associated agreements, contracts at the cost outlined in the board memo and attachments effective January 1st, 2026, and authorize the Executive Director of Human Resources as the superintendent's designee to sign the associated contracts, and that the board authorize the issuance of POs and payment thereof.
Thank you. I think I'm going to have to work on shortening that in
That
the
was a lot.
future. Unfortunately, this memo is our big benefit memo for the year. Our benefits committee with Dr. Williams and our benefits staff and Rooney go over our benefits, and we went through this in the business subcommittee quite a bit, but insurance costs are rising. We are looking to propose a 5% increase to the premiums that employees pay on both the base and the buy-up plan. Unfortunately, this year, the state did not increase the flexible benefit account. So we're surprised by that. There's some questions as to the politics going on, but we have no control over that, unfortunately. While they increased everything else, they didn't increase the amount for the flexible benefit allowance for that to change, so therefore we don't get any additional money from the state this year. Our plan has been doing better with a lot of our programs we've initiated, so we're hoping that 5% premium increase will help offset the increased cost of everything getting more expensive, especially the medications. On the dental side, we are looking to increase our rates by 5% for the base plan and 10% for the buy-up plan. Fortunately for those plans, the premiums are much lower, so those increases are actually not a very large dollar amount. All the rest of our plans are remaining at the costs that they are. One good piece of news in our stop loss for this upcoming year, we already have quotes for at our current rate or below for this year. Now, they're not locked in until they get the data from this last month. So I'll bring it back to the board if it's anything beyond what we paid this past year. But just the fact that the stop loss insurance is not an increase is a huge win for us and may even be a slight savings for us. So we're very excited for that. I'll be happy to answer any questions that you have.
Questions, comments?
Move for approval.
Second?
Dr. McNeil?
Yes.
Ms. Romerman?
Yes.
Ms. McAdams?
Yes.
The chair votes yes as well. Thank you. Finance, consider and take action on the estimate of needs document for the 2025 to 2026 fiscal year as required by state law for submission to the County Excise Board and authorize the board president or designee to sign the final documents. Dr. Williams.
Good evening, Mr. Reyes, members of the board, and Dr. Federline. Tonight we're bringing to you the FY 25-26 Estimate of Needs document. You should have a copy of that. The document, the report is actually prepared by a CPA firm that works for us, Bledsoe, Hewitt, and Gullickson. The document itself goes through every one of the district's funds. But the most important thing that the estimate of needs does is it sets the statutory limitation for the school district's budget that the board can approve. It also documents the justification for the sinking fund millage, which is what we use to pay off our outstanding bonded indebtedness. So if you look back on page 54, you can see the very top box in Exhibit Y where it says appropriation approved and provision made. The general fund, the maximum budget that the board can approve is $176,925,539.32. That increase includes current year revenue estimates as well as the district's existing fund balance. So, as most districts, it is very unlikely we would ever want to set a budget that high. Would not be a prudent thing to do, but that is the legal limitation. On the following page, on page 55, is the information related to the sinking fund millage, 30.88 mils. That is determined by the district's outstanding debt as well as the net assessed valuation. I pointed out in the report that our valuation grew at a slower pace this year than what we have seen. It's just under 3%, but we were able to keep that millage rate within historical ranges. So if you look back, our budget book has actually a really lengthy recap of our millage. You can see that we've consistently been in that 30 to 31 mil range. So pleased to report that. I'd be glad to answer any of your questions.
Questions, comments?
Just so I'm reading this right, the appropriation approved and provisional made of general fund, that's what the total amount that we could have, and the total valuation is where we're at.
Well, the appropriation approved and provision made is the ceiling for the budget
Gotcha.
that the board can approve. We're always well below that.
Okay.
So the information on the property valuation is the assessed value of all personal, real, and public service property within the district's boundaries. Does that help?
Yeah, that helps. A lot of big numbers.
It is a lot of numbers.
Move for approval.
Second?
Dr. McNeil?
Yes.
Ms. Romerman?
Yes.
Ms. McAdams?
Yes.
The chair votes yes as well. Thank you. Consider and take action on the general, building, and child nutrition fund operational budgets for the 2025 to 2026 fiscal year as outlined on the statements of revenues, expenditures, and fund balances. Dr. Williams.
Thank you, Mr. Reyes. You should have a copy of tonight's presentation. We tried to boil that down from the budget booklet so you wouldn't have to flip through a whole bunch of pages. Unfortunately, this is kind of a whole bunch of pages with a lot of little numbers, but couldn't be avoided. One thing I'd like to point out, I'm really proud of the work that the budget department has done this year. Jessica Wright and her team have completely revamped our graphics for this presentation tonight, as well as the budget book, and I'm super proud of the work they've done for this year's budget. Okay. This first slide, and I do apologize for the busyness, but there's an awful lot of information here. This first slide is the general fund only, and this is a summary of all the revenues and expenditures. We include what the board approved as the temporary appropriations budget in June, and highlight in bright union red our proposed 25-26 budget that we're asking for your approval tonight. The revenue is totaled at $153,745,282. That's an increase of about $1.1 million over the preliminary budget. And the expenditure budget is $154,749,687. That's about a $1.2 million increase from the preliminary budget. A couple of things I will point out. We typically are very conservative in projecting our revenues, but pretty pessimistic in projecting our expenditures, which is kind of the way we like to operate. So that hopefully our actual collections will come in higher than this budget number. I will point out that the district ended last year with a fund balance in the general fund of $20.3 million, which is about a 13% of revenue fund balance. The state law limits us to a 17% fund balance. We are well within that limit, but sufficient enough to meet our cash flow needs and pay our bills on time. So that's what we want. Oops. Okay. This is the revenue budget, and again, we just kind of dive into both the revenue and expense in a little more detail here. But what you can see is there are a number of changes from the preliminary budget. I've summarized what our changes are on this slide. You can see that we've had a gain, we expect a gain in our ad valorem collections associated with that valuation growth. Some of our other local sources that we noticed some gains in included a number of local grants, our extended day program where the board increased the tuition in order to cover the cost of that program, and our facility rentals. Probably the biggest change is the reduction in the state aid from what we expected initially. I will say, and I'll touch on this in more detail in a minute, our state aid allocation reflected a loss in our weighted ADM and our student membership for this year, so that was unfortunate. The factors were increased by about $20, but unfortunately not enough to offset that loss. We also had originally built in a contingency for an increase at mid-year. Based on what we've seen, we felt like it was prudent for us to remove that contingency. We don't expect a gain at mid-year, so if we do, it's a nice surprise. But based on what we've seen with our enrollment patterns, it's probably not in the cards for us this year, unless the factors go up considerably at midterm. Our state sources, you can see that our FBA allowance went up. Even though, as Jay mentioned, the FBA is not slated to increase for FY 25-26, there was an increase at the beginning of 26. And that increase is annualized, and that shows up as an increase in our allocation this year. We have our teacher empowerment funds that weren't initially in last year's budget, and our maternity leave, which have all provided additional revenue to the general fund. The biggest change overall in the budget is the reduction in state funding. As you all remember, once those ESSER funds went away, which we were really sorry to see them go, you'll see that our federal revenues are returning to a more typical level for us. So those are some of the changes that you'll see on the revenue side. When you look at the revenue budget as a whole in the general fund, what you see is kind of a typical pattern for our district. And what I mean by that is the state revenue sources, which are the red piece and the light gray, account for well over half of our budget. 56% of our budget in the general fund comes from the state. The largest piece of that, of course, is state aid, where we are so heavily dependent on our student population growth. Again, our federal sources down back to around 8%, which is again, more typical for our district. This comparison shows revenue trends over the years, and you can see fairly stable with the exception of an occasional increase in state funding associated with a teacher pay increase, but really ad valorem growth continues to be steady. And I do apologize, this is a really small chart, a lot of little numbers on this one, but this is as a point of reference. This is our state aid information over the last few years that we track and analyze various changes to our state aid. As I mentioned earlier, this year's allocations, which are in the red section down at the bottom, our average daily membership went down to 14,844.86. That was a reduction of 113.66 in membership, and that weighted count, that equated to a weighted student count reduction of 153.55. Any questions so far? We also wanted to provide you with information about the flex benefit allowance. This is an important piece of our financial information, as well as an important piece of our health insurance plan. So under the state law, employees have the option of taking the flex benefit allowance, and that is about $603.46 a month. For those folks who are enrolled in the district's insurance plan, that pays the single premium, and that premium then goes into our self-insurance fund to pay for medical claims. For those who choose to waive the insurance coverage, we do require that they provide proof of other insurance, but they do receive what's called a waiving allocation. About $70 a month if you are a certified employee, about $189 if you are a support employee. So much less of a value. The state encourages our employees to be on the insurance plan, and accordingly you see the numbers. We typically have well over 1,700 who receive that flex benefit allowance. Sometimes we do have people who have insurance through other sources, maybe a spouse's coverage or something along those lines, and they elect to take the waiver. Okay, on the expenditure side of the budget, again, our initial budget for 25-26 was based on estimates. We have, since we asked for approval on that budget. We have completed our hiring, we have encumbered all salaries and benefits for the year, and are able to set our budgets very accurately so that we can monitor them throughout the year. So you see that those amounts are more in keeping with our actual 2024-25 expenditures. But again, that's about 154.7 million, an increase of about 1.2 million. We'd like to highlight the positions that were added this year, and after a careful and thoughtful process of reviewing the request, the budget recommendation includes the addition of 12 teaching positions. These are actually, I call them teaching and certified positions because some of them are simply certified positions. But the good news is that that's including the addition of a teaching position for the aerospace and medical academies. So we were able to do that this year. We added a math position, 3 early childhood positions, a reading specialist funded through Title I, a parent community liaison, a teacher for the Red Hawks Rise program, a teaching position for the DRS work adjustment program, and a family and student support specialist position. So that kind of is what makes up those 12 certified positions. We added 8 classroom aides based on needs in our buildings and class size considerations. And then we added 10 what I've listed as other positions. And you can see at the box at the bottom that includes the 4 bus drivers, 3 in child nutrition, and 3 custodial positions. So despite the difficulty of the budget this year, I'm really pleased that we were able to fund those important positions. This chart shows our general fund by what we call function code. This is important because it shows how the vast majority of our general fund budget is dedicated to instruction. That big red section that's about 54% of the general fund, instruction is defined only as expenses that take place in the classroom. So it's teachers, it's aides, it's textbooks, classroom materials, things that happen in the classroom. The second largest is the category of student support, and that includes items such as attendance and counseling, nurses, psychologists, speech pathologists, and audiologists. Instructional support includes items like library media centers, professional development, and instructional technology. General administration includes the expense of the superintendent's office, the Board of Education, legal expenses, auditing cost, as well as election cost, and so forth. School administration includes principals and principal secretaries. So, you know, the point is we look at all of these and we look at the dollars that are flowing to various expenses, be it custodial costs, be it transportation, be it the many categories. All of this is what it takes to operate our district in a smooth and professional fashion. When we look at expenditures by object, we see the breakdown by the various spending categories, salaries and benefits. Those are the ones that we understand pretty easily, and you can see very readily that the vast majority of the general fund is dedicated to salaries and benefits. If you look at the graphic, you can see that the big red section, which is salaries, combined with the black section, which is the benefits, that's just under 90%. It's 89%. So that's a pretty typical measure in a school district in Oklahoma, and I think it's right where we should be. We want to be staffing and maximizing those salary and benefit dollars to the best extent that we can. protecting those positions and paying people as well as we can, and being very careful and frugal with our other expenses. But again, there are other expenses. So things like legal expense, auditing costs, utilities, repairs, supplies, materials, insurance, those are all things that are come out of the general fund. Does anybody have any questions on the general fund before I move on to the building fund? Okay. The building fund is a little less complicated. It's primarily funded through ad valorem taxes, as well as interest earnings. The interest earnings that we receive on our bond funds go into the building fund, as well as the Redbud funds, which we are receiving for the third year in a row from the state. That's $2,250,000. Those funds can be spent for any building fund purpose, so that gives us some flexibility and, quite frankly, some relief from the general fund for expenses like property insurance, utilities, and allows us to do things in the general fund like hiring 12 new teaching positions. So Redbud Fund, very important for our district. It is designed by the state to equalize building fund expenditures among property wealthy districts and property poor districts. The vast majority of our building fund expenses are salaries and benefits, which we've historically paid for our security, as well as a number of our grounds and custodial employees. Again, vast majority of building fund is those salaries and benefits. Child Nutrition Fund has been traditionally been a real success for our district and continues to be. In the Child Nutrition Fund, we always set the expenditures a little higher than we think necessary. Our revenue that we expect for the Child Nutrition Fund for this year is just under $12 million. It is a large business, as I'm sure most people will tell you. It is divided between the cost associated with staffing and food purchasing and preparation. Due to the possibility of price increases through the year, and due to the costs associated with commodity purchasing and processing, we set that expenditure side budget a little higher in child nutrition to cover those costs should we need to. We've also been fortunate to be able to fund several cafeteria renovation projects with our Child Nutrition Fund. In fact, we have had to spend that fund balance down over the last few years. So it's been a tremendous resource for us. Again, the vast majority divided between people and food. And that's all I've got. I'd be glad to answer any questions.
If we were to actually have the appropriate per pupil funding, would that be under general or state aid increase?
So I can tell you this. I actually talked to Dr. Nelson's class a couple of weeks ago. If we were funded at the level of the 6 surrounding contiguous states, Oklahoma is so underfunded that if we were funded at the average, our district would have about $46 million per year in extra state aid revenue. I think I got that right.
Thank you.
Any more questions, comments?
Second.
Ms. McAdams?
Yes.
Ms. Romerman?
Yes.
Dr. McGill?
Yes.
Chair votes yes as well.
Thank you very much.
Thank you very much. Have any new business? None? Opportunities, comments? Alright. Dr. Federline?
Yeah, just two quick things. We're off to a fantastic start for the school year. I want to thank the board for their involvement, their support. I want to thank everyone here in this room and everyone who is not here in this room, all the teachers and support personnel that are getting us off to a fantastic start. Buildings look great. Buses are vastly improved, and instruction, as always, is excellent. Second thing, I just want to thank you, Dr. Williams, and the members of your team. These pages, these graphics, the information presented here represents a tremendous amount of work and detail that is excellent as always, but more importantly, reflects a commitment by Union Public Schools to transparency of our taxpayer dollars. There's a lot of rhetoric out there that says schools are somehow being wasteful, or that somehow schools are underfunded, or we're sitting on piles of money. And I think this data proves otherwise, that we are extraordinarily responsible and thoughtful about where our dollars go and how they are spent to ensure that we maximize student achievement. So thank you.
Thank you. Next is executive session, mote and vote pursuant to Oklahoma Statute Title 25, 307B11, to go into executive session to discuss terrorism and safety issues.
Second.
Ms. McAdams?
Yes.
Dr. McNeil?
Yes.
Ms. Romerman? Chair votes yes as well. We are now in executive session.